This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. What a beautiful day outside. Hopefully you had an opportunity to get out this morning and get a walk in. You know what? It's too late now. You got to listen to me. This is Dr. Tom Roselle. We got a whole bunch of good things happening for you today. Listen, happy Father's Day. I hope all of you are treated very, very well. Those of you who are fathers and those of you who aren't fathers, why don't you go out and adopt a child for the day and make that your Father's Day gift? What a beautiful situation. Wouldn't that be great? I think it would be absolutely spectacular for you. Adopt a child for Father's Day. That's a great idea. But really, seriously, happy Father's Day. Hope you're enjoying it, whatever you decide to do, and hopefully your family is around you or at least picking up the phone and call you if they're not in the area. Give me a call, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're going to touch on several different things, and hopefully that will stimulate you to think a little differently than what you have up until now. I want to remind you, coming up October the 18th, 2014, what's that? Ageless Health 2014. It's a day that you will not soon forget. It's our annual conference that we do every year on different subjects, and it's designed to do one thing, to give you the tools, and that's what this is all about, the tools to improve your health and your wellness. Go to our website, go to rosellecare.com, that's rosellecare.com, and check it out. See what the topics are, the speakers, and so forth. And this is a day that starts in the morning, and while you're registering, you get to learn about core training exercise. Then we start the conference. I kick it off, and we start giving you so much information. We set the stage, and each presenter tandems into the next. You're going to get a break. You get to meet some vendors. At lunchtime, we provide lunch for you as part of your admission, an organic lunch. And while you're enjoying that lunch, you get to watch a beautiful presentation of Chinese-based Taiji as they call it. And it's done by the Chinese Martial Arts Institute in Maryfield. What a day. Absolutely fantastic. We go back into the afternoon, and at the end of the day, I wrap it all together for you, and I put it together in a package that you will be able to use the very next day. How to increase your wellness potential, not only yours, but then that of your family. Join us. It's inexpensive. If you register before July 1st, by July 1st, the price goes up by $40. $59 right now. Get online, register today. That includes your lunch. We lose money, you gain. Let's do it. I'd love to have you there with us. Our number here is 888-630-9625. Let's talk about several things that are out there, and I think things that you need to know about. You know, I've been beating the bandwagon on different types of medications and drugs over the last month or so, and, you know, a lot of people come up to me and say, hey, you know, that's great. I know you don't like drugs that are used indiscriminately, and there's all kinds of side effects, relative to those things, but, you know, what can we do about these types of situations? Well, one, your body is extremely forgiving. You just have to make some modifications. But let's talk about something called cardiovascular disease. And let's talk about the connection, if you will, between the heart and the brain and the nervous system, and some prevention ideas and things of that nature, because I think that you're going to be impressed that, number one, there is a connection. And, you know, we'll talk about that in a second. But more importantly, not only is there a connection, but one that you have absolute and total full control over. It's not something that just happens or happens to you. You have the capacity to change virtually anything and everything about your health. So we're going to get into that a little bit, but let's talk about, the process. First, the heart, that little pump that's in the center of your chest that has to push all that blood through you day in and day out and transport oxygen, transport nutrients and vitamins and minerals and so forth. The thing that keeps you alive, right? If it doesn't work, you're not here anymore. The problem is that you abuse it from a lot of different points of view. This is truly a situation where we talk about structural, chemical, and stress, emotional. So we know that the heart is hard, tough muscle that is stronger than virtually any other muscle in your body. That guy's got a big job to do, right? And to do that, it has to have electrical input. Well, the heart actually has 3 electrical sources. It has the pacemaker within the heart, several pacemakers, and that allows for the fail-safe for the regulatory pattern of the beat of the heart, with the atrial chambers, the upper chambers filling the ventricles, and the ventricles pushing the blood out. And as long as this rhythm continues the way it's supposed to, everything is good. But it has 2 other inputs. It has nerves from your back, particularly your upper back, and it has a nerve from the brain called the vagus nerve. All 3 electrical sources serve the heart and make it work effectively and efficiently. Let me tell you how important all these kind of backup systems are. If you have a heart transplant and they take the heart out and they put another heart in, well, they have to cut away the nerves from your back and they have to cut away the vagus nerve. And the only thing that you have now that is causing the heart to beat properly is the pacemaker. So guess what's if you ever get sick again, you ever have disease process where you're going to go into a heart attack, guess what the first sign will be for you? It's called death. You have no way of determining that you're in another process simply because, see, those other nerves are the ones that give you the heads up. They give you the chest pain, they give you the heart pain, they give you, the throat pressure, all of that stuff. So this electrical system is extremely important, and it's regulated by many different things. It's regulated by the body posture and body position. It's regulated by the way this big muscle that cuts you in half is called the diaphragm. That diaphragm allows you to pump the heart. It just doesn't do it by itself. It contracts by itself, but you still have to have more. You still have to have this little, this other little push going through. So we have to look at the capacity of the muscles, the fibrils, the individual fibers of the heart to be able to do what they're supposed to be doing. We have to look at the secondary mechanism, all those chest muscles and diaphragmatic muscles and so forth that also help in the respiratory pump motion, the cardiovascular pump motion. They're all there for a reason, not just kind of, because we wanted to compartmentalize things. So it's important to get how this works and that they're all innervated by nerves. So we're going to talk about that as we go on in the program today. But let's talk about, some of the predisposing situations. You've heard forever this whole thing, this danger about fructose, this nasty, ugly thing out there. We talk high fructose diets increase all kinds of problems in the body. And not only they increase your problems with diabetes, and we know that if you're diabetic, you have an increased problem with heart disease. But, huge studies over the years with overweight people showed that a really high fructose diet, and that means any kind of fructose in my brain, promotes insulin resistance and increases the fat inside. You've heard me say, skinny fat person. Well, this is where it happens. You get all your organ systems get shrouded and covered with fat. And when you do a blood test, you see your triglycerides. There are different types of fats in the bloodstream that just kind of float around. If your triglycerides are way too high, you got blood like a milkshake. And they increase as you particularly add fructose, in the diet. An effect that when you have just straight old glucose in the body, you don't see it the same way. Insulin resistance, what that means is that, see, your pancreas has to produce a chemistry called insulin to transport blood sugars into the body. And that becomes a resistant pattern when you have high levels of fructose. And subsequently, you can't get it through the shroud. The shroud is this veil of inflammation that occurs, and nothing transports anymore. So liver itself becomes damaged by fructose, and the fat levels of triglycerides go up, and the liver fails to manufacture the things that it needs to. Results in what? Liver fatty disease or fatty liver disease and type 2 diabetes, and you end up with all this fat accumulating around your organ systems, but more importantly, what we're talking about is around your heart. So fructose elevates something else called uric acid. So I have a lot of patients, and that gouty thing. Remember our caller several weeks ago? We started going back and forth with all that, with the tea that he got that dropped it down. Well, if he or anybody else has any kind of fructose in his diet, you're dramatically going to increase uric acid, subsequently increasing the effect of gout in the body. Most sodas that you drink today currently are sweetened with high fructose corn syrup, partly because fructose is sweeter than anything else, and we know that we're all addicted to that sweet taste. We got to have the sugar. We got to have something in there. And increased consumption of any kind of soda is going to do what? It's going to dramatically increase weight in the body. It's going to increase inflammation. Even fruit juice, by the way, which can be high in fructose, yes, it can be high in fructose, has been linked to type 2 diabetes, increasing the risk of cardiovascular disease, and increase the risk of the vascular impairment of things that end up like stroke and heart attacks and things of that nature. So we could go on and we can talk about all the different predisposing factors of it. There's this thing, and I want to bring it to your attention because it comes up in the practice all the time. We say, you got to eat fish because fish is good for you. It has, the main omega-3 fatty acids, that are there, DHA, EPA, DPAs. And we tell people, you got to do it. You got to eat it. DHA is incorporated into the membranes of the heart muscles. And subsequently, without it, you have increased risk of oxidative damage. And, that little marker that we do when we take a blood test is called coronary C-reactive protein. Well, that thing is affected by fish only because of the fact that it affects it one of two ways. It drops it down, but it also, if you eat things like swordfish, if you eat things like shark and tuna, the big predator fish on an ongoing basis, it actually will increase coronary C-reactive protein. Yeah, that's kind of, a catch-22, right? You want it, but if you eat the wrong stuff, so what are you supposed to do? You're supposed to eat the small guys, the guys that live off the planktons, probably the stuff you don't like to eat, like sardines. And, that's my favorite fish anyway. I like that kind of stuff. And that dramatically increases your omega-3 levels, and, you don't have the risk of mercury toxicity. And toxic mercury in fish is a concern, not only for pregnant women and our mental states and so forth, but definitely for cardiovascular disease. The higher the risk of, the higher the levels of mercury, the higher your risk of cardiovascular disease. So we're going to talk about that a little bit more in detail, and then we're going to get into some of the things that you can do to prevent. I'm not going to bash drugs because already I'm on the war wagon about that anyway. But I'm even going to give you a break. We're going to talk a little bit about chocolate, cocoa, and how it's really good for your heart. Yeah, I even have to succumb. And those of you who are blood type A's, and if you drink a little bit of neutral coffee, guess what? You can do some really good things to reverse the process. But we've got a whole lot of things coming up for you in this segment, and I think that you'll enjoy. Subclinical thyroid problems and cardiovascular disease, they kind of go hand in hand. It's kind of interesting, and the reason that they're called subclinical is because they're not detected on blood tests, and they don't necessarily show that they have extreme symptoms, and that's the problem. It's the side effects and the other things that are linked to them that are the problems. So low level of thyroid hormone actually showed a problem with the heart by decreasing the heart rate initially, unless you went into Hashimoto's thyroiditis, and then what happens is the heart rate goes up. And there's, you have to be very careful of that. So what does that have to do with anything at all? It has to do with the fact that our dietary patterns are so impaired. We used to put iodine on things, and iodine is a number one critical factor both in thyroid problems and heart disease prevention. So if you're not getting enough iodine in your diet, you dramatically increase your risk of both. So what they're doing, they're substituting out iodine today for another halide called bromide. And bromide competes for receptor sites in both of these organ systems, subsequently increasing your risk to hypofunction or low-level problems in both of these guys. It's amazing. We're going to get into this in detail and very specifically, but more importantly, we're going to answer your phone calls. Give me a call, 888-630-9625. See you in a minute.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625. Give me a call. Love to talk to you. Happy Father's Day, guys. Make sure that you enjoy your day. And by the way, if you're not a father yet, go rent one. Go get a foster kid for the day. Take them out with you. Take them fishing. Take them golfing. Go do something fun. Step up to the plate a little bit. Seriously, happy Father's Day. I hope you enjoy it. I hope you're surrounded by everybody that you care about and they love and that they kind of applaud you for, being the anchor of the family. It's summertime, or we're very close to it, and if I'm asked one time, I'm asked probably 300-400 times a year without exaggeration. And what is that? That's about sunblock. What do you need when you go out in the sun? How do you protect yourself? And so I'm going to tell you what I tell everybody. Number one, you have to make sure that your fatty acid levels are up, your omega-3s. You have to make sure they come from a really good source and you get high enough levels of fatty acids because guess what? They do protect you in the sun. Secondly, if you want to know a very specific product, there's one that I do recommend. It's called Third Rock Sunblock. How do you find it? You can go to our website. We've got it there in our B&B stores. So go to Roselle Care, ROSELLECARE.com, and go to that place called our iStore. Click on it. You'll see Third Rock Sunblock, and you can order it. We have a direct in with the manufacturer, so you'll get it less expensive there than you will anyplace else. Third Rock Sunblock, RoselleCare.com. That's how you find it. And by the way, while you're there, take a look around. Don't forget to check out Ageless Health 2014. And if you don't own a copy of my book, Ageless Health, Health is a Do-It-Yourself Program, what a perfect time to buy a late Father's Day gift. Just go get a card today, say, Dad, this is coming, and buy him a copy of the book. It's straight on. It tells you how to fix things, what to do about them, why your body breaks down. It's really straight up. Let's go to the phones. Bernice, thanks for calling. How can I help you? Thanks for listening.
I have a question about kidney stones. How do you prevent them? And I might have one. I went to the doctor and I had blood in my urine, and I had a pain by the belly button, but lower on the left side, and then it went up, and then it went around to my kidney. But it wasn't a super bad pain. It was just an irritating pain all day long, and it went away. So.
Yeah, kidney stones are no fun. It's actually the worst pain that exists. The pain of, it's called renal colic, is awful. And, I mean, all of women who have had them will tell you that it's even worse than childbirth. So, having said that, any kind of stone, whether it's the kidney or the gallbladder, is there because the body is allowing calcium to precipitate out for a lot of different reasons. It means that the system is too acidic, and we've got to change a few things. Now, magnesium all by itself, I like magnesium glycinate, but there's some other decent forms for this particular situation. You want to make sure, if you're taking any kind of calcium, that your magnesium level is 1-for-1 minimally. In this case, more magnesium than calcium. I would even go 2-to-1, 2 parts magnesium, 1 part calcium. Making sure your vitamin D level is high enough, because if your vitamin D level is low, you're going to increase your risk of that situation as well. Having said that, if you want to alkalinize your body, use Bragg's organic apple cider vinegar. You do that in the morning, a couple tablespoons and a little bit of water, and knock that down and make sure the water's not cold. It's got to be slightly warm, and drink that on an empty stomach before you drink anything else. That helps. Make sure that it's a purified water, that it doesn't have a lot of sediment, because then you're going to precipitate the sediment out of the water. Things like dandelion root, by the way. Dandelion root is a great tonic for the kidney, and it's a great cleanser. And you can either do it in the springtime. You can go get your own dandelion if it's organic, and make some dandelion broth, or if you're like me, you like to eat it, so you can do it that way. Or you can get it in capsules, and about 500 milligrams, maybe about 3 times a day. There's an herb called uva ursi, and it's a common folk remedy. It's been out there for a long time. It's usually used for infections, but it also can help reduce any kind of pain pattern in the kidney by decreasing the inflammatory response due to things that are coming up. Horsetail is another herb, and it's also another natural remedy for kidneys. And you can go on. I mean, there's things out there like pomegranate juice and even celery. By the way, I'm sorry. Cranberry
juice?
No, pomegranate.
Okay, but no cranberry? Because that's what I bought.
And the cranberry's okay, but it's not as powerful.
Oh, okay.
Okay, it's not as powerful in my experience anyway. Celery is a mild diuretic. It definitely will decrease kidney stones. A lot of studies have shown that it has a dramatic input on it. Basil coming over the back of my head is good, but you got to get rid of things like sodas, and you got to get rid of things like dairy products, and never use a spinach product with a dairy product, because it'll precipitate out something called calcium oxalate crystals, which are no fun. And so it can go on. Using lots and lots of water, making sure that the water, you can even use water that will begin to leach, but don't use unfiltered water, because you have all the sediment and you're going to put that back into the system as well.
Okay, I use the water from the fridge, and I do have a filter, so that's okay?
Yep. Listen, I got to go. We're at the end of the segment. Talk to you soon. You're listening to Dr. Tom Roselle. We'll be right back after a message.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Happy Father's Day. 888-630-9625. That's how you find us here. And if you'd like to find us off the air, all you need to do is go to rosellecare.com. That's ROSELLECARE.com, and send us a note, and one of us will get back to you as quickly as humanly possible. Kind of an interesting day today. There's a lot of things in the news. I wish I could cover them all. That's why this program needs to be a whole lot longer than what it is. But having said that, it is what it is, and we need to talk to you about things that can be a benefit to you. We're talking about cardiovascular disease today, and not slamming the drugs. I'll be a nice guy today. I won't do that. But we'll talk about some of the things that you need to be aware of and how to fix that. But we want to get to your phone calls as well. Let me touch on one area. We talked about the heart being multidimensional element, and it has all kinds of things run it, but it's run by the nervous system. So here's the deal. I have a lot of patients that will come into me after a slip and fall accident, or they're in a car accident, or they're in a postural pattern where they're constantly jamming their neck and their upper back. One of the symptoms that we see, or several symptoms, but one of the areas that we see involved is the heart, because those nerves now get pinched, they get irritated, and the heart begins to misfire, or we see the heart starts fluttering, or they're in a constant stress mode that is affecting the neuromuscular system. Until that's normalized, you can take all the drugs in the world. You can take Ativan and try to regulate the heart, and pretty soon, your heart just, is going into this arrhythmic condition. Until you affect the nervous system, and you do it properly. And by the way, once it's affected properly, you can reverse it completely. This stuff doesn't go away. You just get hooked on a series of meds. And the meds are there designed, to help you out and save your life. But then you get into this over-medication thing, and it has its own sequelae, its own side effect. So if you've seen that in your own life, meaning that over a period of time, you really try to take care of yourself, but you're still having these regulatory problems and even blood pressure creeping up with, that's associated with too much stress in the heart, or the heart flipping around. You're sitting there at nighttime and you're trying to get to sleep and your heart rolls. It could be simply neurological irritation from that nerve called the vagus nerve, or the parasympathetic nerves that come off the back, particularly from thoracic 1 and 2 area. You need to have that checked out. In addition, and in my opinion, before anything else, before you submit to any kind of craziness that's going to be on for the rest of your life. Not a good thing. One other interesting article, then we're going to get into some detail, that they looked at aspirin and how aspirins would increase the prognosis of patients who were on or were going into any kind of surgical intervention whatsoever, whether it was to remove plaque or to do a bypass or do any other type of heart procedure. And what they found is that it had absolutely no impact in preventing anything or increasing the outcome of the surgical risk. And what it did do is dramatically increase the risk of bleeding, which we know that's what aspirin does. So don't let your physician talk you into taking an aspirin, and you need to reference and say, hey, listen, doc, there was an article in the New England Journal of Medicine that said I shouldn't be doing this, and it will actually increase my risk of bleeding during the surgery and post-surgically. Interesting stuff. Let's go to the phones. Tom, thank you for calling. How can I help you, sir?
Hello, Tom. Thanks, Doctor. Thanks for taking my call. My 5-year-old was diagnosed with a urachal cyst, in which actually he's on antibiotic. They put him on an IV in the hospital. They didn't want to do surgery because they wanted to clear up, and they
Go ahead. I mean, a patent urachus is, as you know, is the failure of the urachus to close completely after birth, and it's one of those things that you need while mom's nourishing the baby in utero. Obviously,
right.
At age 5, it should be closed off, and you shouldn't have any trouble with it as well.
Yeah, they sent him on his way. They gave him oral antibiotic, and the other day it started to leak again. And what we're waiting for is him to completely finish the antibiotic and then have the procedure, I assume, to be performed. But it just started to leak a little bit, then it stopped. I told my wife if it does it again, go right back to the hospital because
if it's still leaking, I mean, there's unfortunately as it goes on too. If it's one of these things that hasn't been fully resolved by the body and they don't do surgery, it always will be an impaired process. Now, if you listen to the program, you know I'm not the guy that's going to jump at any kind of surgical procedure. But in this particular situation, if that urachus is patent, if it's open and it's constantly being infected and so forth, it has to be closed. And you're going to need to, for my money, I would get 2-3 opinions of what's going on. Any infection in the body is going to be made worse by increased sugars in the diet. So in preparation and also to get the infection under control, you want to eliminate any sugar from your son's diet. You want to get anything that causes inflammation, the typical allergen patterns, wheat and soy and corn and dairy. You want to eliminate those just arbitrarily and see if that doesn't help get this thing under control. I would give him vitamin C. I would be giving him a little bit of vitamin D, omega fatty acids. I would make sure that even if you had to make smoothies, get a ton of vegetables in this guy, and that will help prep him and get him ready for perhaps surgery. You might get lucky along the way, and it may close. But if you're anticipating having to go through surgery to begin with, that's where I would start.
Do you think there's a difference between through antibiotic through IV or through pill? Can there be? Because when they gave him the IV, it seemed to have closed up and there wasn't any leakage, and then they gave him the pill to go home with, and we got that little bit of leakage.
Sure, but what it's telling you is that it's not getting to it anyway, because if the IV antibiotic, the IV is much more direct, and it's going to hit it. It's when you got to get to something right now. You don't want a peritonitis. You don't want to get into the abdominal area. You have to impact this thing. So obviously, what's happening is the oral antibiotic is not getting absorbed at the level, at the strength that it needs to. But having said that, the fact that it's reoccurring tells you that there's either a predisposition to the infection or they're not getting to the infection. So I would have, again, if it was my child, I would be getting 2-3 opinions. I'd be doing my homework, and I'd be going down to Children's, doing that sort of situation, and then weigh the evidence. But don't waste a lot of time. You owe it to your son to get that thing closed up.
Definitely. Thank you, Doctor.
You're welcome, Tom. Thank you for calling. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. We're talking a little bit about the heart and some of the stuff that goes on with the heart. And it's unique because it's what keeps you alive, right? It's one of those things that if it doesn't work the way it's supposed to, you're in trouble. And we don't want you to be in trouble. We want you to live long and well and making sure that everything works the way it's supposed to. There's a connection between the heart and the brain. And you need to have a very close and intimate understanding of that relationship. There's this thing called, I use it lightly, it's called neurocardiology, and it can be divided into several different sections. One's the brain's effect on the heart, and, neurocardiac syndromes. In the medical profession, they start talking about things like enlarged heart patterns, the heart's effect on the brain, and it's called a very, very muddled area. But let me just try to put a little bit of clarity on it, if you will. Simply because of the fact that if you understand the electrical power of the heart, you understand all the synergistic elements of the heart, and you can balance this thing properly. Apparently, there's a lack of appreciation in my mind of the link between the cardiac system and the brain, and it's probably due to the singular look, we'll call it a monodisciplinary approach by cardiologists, and then the neurologists look at it, but they look at it from their point of view, and it's this whole compartmentalization that takes place in so many different things, so many different conditions over a long period of time. Instead of realizing that, number one, the brain and the spinal cord control everything first. But we have to look at it as a functional model, not as a sequestered, independent model. Functional means that it works interrelatedly with everything else in the body. So now it begs the question, particularly in this hybrid field, what we'll call neurocardiology, but we need to put the word functional neurocardiology in the forefront, is that why do things work the way they're supposed to? That heart, that little contraption that sits in your chest, it's albeit very important, but it's not strong enough to push the blood through all of the vessels. There's other pieces that are involved. There's other external electrical influences. So we know today, in today's world, that there are places within the brain that have signals, and that if those signals aren't working the way they're supposed to, then it can't stimulate the neurological input to the heart itself via the pacemakers, via the spinal nerves, via the vagus nerve. Here's the interesting thing. If the pacemakers were independent of everything else and totally isolated within the heart, and they were supposed to be able to run this apparatus then why do pacemakers fail? Why do you have to go to an electrical cardiologist and have your heart zapped to get them back into rhythm? It doesn't make a whole lot of sense when you look at it and you really stand back and take a look at these things. These neurophysiologists, these neuroelectrical physiologists, if you will, again, compartmentalize everything into one area instead of looking at what the connection is between the brain and the heart. And we know that the brain can be influenced by any kind of trauma to the upper portion of the spine, the cervical area, or the brain itself. The skull bones that house the brain have, 22 individualized plates, and they sit in there in tongue and groove, and they move as you breathe in and out, and they help pump spinal fluid, but that also causes an electrical effect in the body. And so when you end up looking at the intimacy, the interrelationship of when the brain sends signals, if any of those initial structural things are disrupted in any way, then you can't get the normal input from the brain to its components. In this case, we're talking about the heart itself. There was an issue or an article that was in an issue of the Netherlands Heart Journal, and it's very timely, I thought, in its perspectives. And it was kind of an intriguing read because overseas they get it. Here we somehow miss the boat. It was very intimate. It was very interesting clinically, and it talked about the relationship between the brain and the heart, and it describes the role of something called the autonomic nervous system. You can substitute the word automatic, and what's called the big chambers of the heart, the ventricles, and how they beat and how they move, and how psychological stress and trauma can cause the cardiovascular system to be disrupted either through electrical systems. They call it, I think the term they used was neuromodulation. I think that's why I couldn't remember it, because it's too big of a word for me. Anyways, and then how it stimulates the vagus nerve. They call that vagal stimulation. And in many situations, how they actually stop the transmission of neurological signal and also the disruption of certain types of music. And it was a very extensive article. I was very, very much impressed and also intrigued with it. And as I went through, you can look this thing up. The article was The Heart and the Brain, an Intimate and Underestimated Relationship. And the primary writer in this thing was somebody called Damon, I think. D-A-E-M-E-N. I'm using my brain, which today isn't, as quick as it normally is. But nevertheless, check it out. You can find it under that, and it's under Netherlands Heart Journal. Most of the stuff is online, and you can read it to your heart's content. But it really got my attention. It really intrigued me, because it was the first medical journal in a long time that really got and understood that the nervous system, if it's not working the way it's supposed to, is going to cause a problem in cardiovascular health, dramatically increasing the risk of all kinds of different things that we try to prevent with medication. And then also went on, there was a couple other pieces that went on and talked about dementia. And if that nervous system isn't working, that there's going to that not only will we have a dramatic problem with advancing demential states with just old age dementia and Alzheimer's and so forth. But if we don't do something about this, it's going to double to triple the problems. So take a look at it. It's pretty understandable, even without any medical background. Read the introductory, the abstract, and then read the synopsis, the conclusions, and you'll pick it up. You'll understand it. 888-630-9625. Want to remind you again that coming up October 18th, 2014. I'd love to have you with us. It's going to be a great day. This week, I'm going to be at the Ritz-Carlton, Pentagon City from Tuesday night through next Sunday morning. And the reason is it's truly a gathering of eagles. It's the International College of Applied Kinesiology 50th anniversary celebration, 50 years of worldwide impact. And there's going to be over 300 doctors from around the world that are the best at what we do. People from Russia, from South Africa, people from South Korea, from Canada, from Europe, from Germany. And it's a multi-discipline integrated group of guys that really get it. And I have the honor of this year and next year of being the chairman of the association, so I get to run this deal, but I get to sit there and listen to some of the most amazing minds present some incredible information, which you are going to benefit from, because then I'm going to share it with you. I'm going to give you a synopsis. I'm going to tell you what it was all about, and be able to apply it for our patients. We're coming up to a break, and unfortunately we have to take that because we have to pay attention to those who bring you Dr. Tom Roselle Live. We'll be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle and the Roselle Center for Healing present Ageless Health 2014, Proven Tools to Maximize Your Health, Saturday, October 18th at the Fairview Park Marriott in Falls Church, Virginia. At this all-day seminar, learn how you can feel better or feel great when the doctors from the Roselle Center for Healing each discuss a topic that directly affects your health, like your food, physical fitness, preventing injury and disease, your healing process, and more. Learn more at agelesshealth2014.com. That's agelesshealth2014.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Been in studio. Happy Father's Day again, everybody. I hope it's a great day for you. Enjoy it. Make sure that you do what you want to do, but surround yourself with the people that love you and, you know, the people who actually made you a father. You see, you didn't make them. They made you the father. So get it done. Have fun. Enjoy the day. Have a few more calls. I'm going to try to get to at least one more and then let you know about a couple other things that you need to know about. But having said that, George, how can I help you, sir? Thank you for calling.
Dr. Roselle, thanks for taking my call. You really should be syndicated because you are definitely an addicting person to listen to.
Thank you.
My question is root canals. Obviously, I need one. That's why the question. But I've read so much about them that some say they're bad because it puts the infection in your system. Some say it doesn't make any difference. What's your take on that?
Well, the problem is with root canals is that traditional root canals don't get everything out because your tooth is made up of these, not just the root itself, these big canals, but also these little spicules that go off, you know, in a ton of different directions. And when they get in, they sterilize it with traditional, you know, antibiotics that they blow in there. It doesn't get in there. And unless you get really lucky and then they give the antibiotics and so forth, it's a problem and the infection reoccurs. So in today's marketplace, they're saying that the root canal, if you go to a biological dentist, he's going to say pull the tooth. But that was up until very recently. There's another thought process. There's a procedure that utilizes a laser, a cutting laser or hot laser, and they put this little cannula into the tooth after they do the traditional cleansing and so forth. And because laser is light, it permeates. It gets into these little cannula, and it does it enough that the bacteria can be destroyed that get into these canals. The problem with a lot of infections with root canals is that it doesn't start in the tooth. It starts in the bone and then works its way up through the root itself. Most infections don't come as a result of a problem with the tooth unless there's been a cap or there's a filling or something of that nature where it's come loose and bacterium's gotten inside and down in the canal. But in the majority of situations, it comes from the bone itself, from the mandible or the mentum in the upper portion of the mouth. So there's some guys around and they do this procedure, and it's a laser process. Now, if I've had a root canal done, and as a result of it, actually I had two. And I had one that was held very well, and I had another one that I had the tooth extracted afterwards because the toxin was there. And the reason I had a problem with it is because I have a bad habit of clenching my teeth, and I don't grind, but when I'm angry, you can see my jaws firing. I wiggle the tooth. So it's like a stake in the ground, and it starts wiggling, and the bacteria gets deep into the root, and that's the way it happened. And one was when I was in Vancouver, and I was in pain that was so bad that I was holding on. I had acupuncture needles in my hands and my legs and my face, driving the flight attendants crazy on the way from Toronto to Vancouver. And that was the only way that I could handle the pain because of the pressure the airplane was driving in there. So what I would say to you is this. Send me a note, and I will try to get a hold of the address of two guys that do the work that I'm talking about, and I will tell you the pros and cons based on that. And then you can make a decision from there.
Terrific. Thank you so much.
You're welcome, George. Thank you for calling. I appreciate it. We have a couple more calls. Unfortunately, we're right down to the end of the program, and I can't take it. So, see, what you have to do is we have to make this a syndicated program, and we have to get this station to increase it to at least 2 hours minimum, and then we'll spend 1 whole hour taking your phone calls. Have a happy Father's Day, everybody. I'll be with you again next time, same place, 12 o'clock noon. This is Dr. Tom Roselle. Bye.